All right, so we are in week 7. We are going to look at the early adult lesson now. Again, I'm at Starbucks. Sorry for that overhead noise. If you can hear all that, let me go ahead and share my screen so we can get moving ahead. Don't need that. All right, so let me go into the view of students. And we're going to go into we're in week 7. We did the overview. That one's been posted. And so we're going to look at early adulthood. So my guess is that many of you in this class are in this particular developmental stage. So hopefully it can bring some clarity. Maybe you can ask some questions, things to look forward to, things to look back on. Our learning outcomes are the same because we're in the developmental stages portion. And then for this particular lesson having to do with early adulthood, list 4 developmental tasks for the early adult period according to Havighurst, 3 physiological changes that occur during early adulthood, psychosocial tasks for early adult according to Erickson, stage of cognitive development of the early adult according to Piaget, which now is going to be formal operations and it's going to stay there. Examine how moral development according to Kohlberg changes in adulthood. So we will probably still be at the conventional stage, but we will take a look at post-conventional as we move through here. And then 2 health screening tests important for people in the early adult stage. So again, your reading is listed here. There's only one module out of the course Hero reading to look at there. Your activity is the free write, adult learning theory. We'll talk about that in a couple minutes. That was gone over in the overview video, as well as your week 7 journal entry. So we will come back to the PowerPoint. Let's take a look at the developmental theories. So if we go to, I'm hoping these links work. Yay. So Jean Piaget, sorry. Look at what we've gone through. Birth to age 2, right? Pre-operational for your toddlers and preschoolers, concrete for your school age children. And then formal operational, age 11, or we could say from adolescence moving forward. So definitely would apply to the young adult. And being able to extrapolate and think abstractly about things. I like to think of it, and they say it here, that the what if stage. What if I do this? What if you do that? And you can consider the possibilities. And there's a video, if you haven't looked at those already. These are some pretty cool, I think, or I wouldn't have put them there, videos. And so then if we go back, so Piaget we're kind of done with because we stay at Piaget's stage. We may, if we are in, well, it could be middle adulthood, but late adulthood, advanced old age, as some people start to have dementia, then that can change and there can be some regression. So let's look at Erik Erikson and psychosocial development because we've been looking at his theories. And so psychosocial, we started with the trust versus mistrust, autonomy, shame, and doubt, initiative versus guilt. We talked about industry and inferiority of the school-age child. And then the adolescent was identity versus role confusion. Now, there is a little bit of overlap potentially between the identity versus role confusion and intimacy versus isolation, depending on how old and the situations. You can kind of overlap with both of those. And then intimacy versus isolation, I think, is interesting to note. These other ages were maybe six years gap tops. But if you look at intimacy versus isolation, that's the 20s through the early 40s, maybe even mid 40s. That's 20 years for that particular stage. So there's a lot of developing that can happen during intimacy versus isolation. And then we will move on through middle and late adulthood for these other stages. And there's actually a 9th stage that we'll talk about in advanced old age. But for the lesson right now, we would be in the intimacy versus isolation stage. So you develop a sense of self, hopefully in adolescence, and ready to share ourselves. It's that love yourself and then you can love others type of thought. But if you haven't successfully resolved the previous stages, then you may have trouble developing and maintaining successful relationships. You have to have a strong sense of self before you can learn to share yourself with other people. All right, then we will go back. Let's check out Kohlberg's Morality for Adults. Oops, I will open that up. So sorry, that link doesn't work. I will fix that, but that will center on conventional and pre-conventional. We talked about that in the adolescent lecture as well, looking at more societal roles and what a person feels is morally and ethically correct. Let's look at Havikhurst. Stages of development. And so we've talked about this a little bit. There's his picture. We're talking about developmental tasks of early adulthood, specifically here. So autonomy, being independent, getting away from the parents. Who are you? Getting your identity together, becoming emotionally stable. I'm not sure anybody becomes emotionally stable, but hopefully. Career is a big thing. Career and relationships are key themes of young adulthood. Becoming part of a group or community, being involved, giving back maybe to the community as you start to have children, getting involved maybe in like Boy Scouts, Girl Scouts, other school things that children are doing, learning how to run a household with someone else, establishing a residence, and then becoming a parent and rearing children. Again, there's many books now written about these things, but there's no real actual manual of how to accomplish these things. And so a lot of it is through trial and error, or we do what our parents did, or we don't do what our parents did, depending on our situation. And so those are the developmental tasks that we are looking at for early adulthood. So you can see how they kind of go back to that lesson there. It kind of overlaps with adolescence and could also overlap with middle adulthood. All right, and let's take a look at Daniel Levinson. And so Levinson's theory, is thinking about the future, right? If I go to school and I get married and have kids and have a career and get a house and do these things, then hopefully things will move forward. That's kind of how, that was how I grew up. But children today, adolescents, young adults today are finding it very, very difficult to find a house. Relationships, I think, are happening pretty well, but the finding a residence, finding a career, those are a little more difficult nowadays. So he was looking, this is a little more in middle adulthood, the gentleman that he, it's part of early adulthood into the 40s, interviews with men and women, 35 to 45, how can they work through young adulthood and get to midlife? When will they feel fulfilled? And so the stages are here. And there is a period of transition, he says, about 5 years, and periods of settling down last about 7 years. And so these ages are sort of based on the life in the middle class about 30 years ago. So that's why I say, and even now, probably 40, 50 years ago. And so that's why I say these probably have changed for people going through these stages nowadays. So the early adult transition, 17 to 22, I think that's is still a thing. The children try to leave home either for a job, for school, and then getting into the adult world, 22 to 28, committing to a career, an occupation. And then there's a transition around age 30, reevaluating choices, making modifications. It doesn't specifically state about relationships, but that would certainly be in the entering the adult world, finding intimate relationships. And so, after you're married for a while, you have to, marriage is, at least in my experience, is full of ups and downs. It's never kind of, a constant thing. It would be nice, but there's always situations that come up, or something happens with the kids, or somebody loses their job, or things happen. And so you kind of at age 30, and then again, probably at age 40, kind of reevaluate. Am I where I want to be? Am I, are my relationships where I want them to be? Is my job where I want it to be? So this also will play into midlife crisis when we get to middle adulthood a little bit, because of those dips in satisfaction that Pash Cow talks about. So then settling down, becoming involved in the community, and then a midlife transition, so reevaluating previous commitments. And the key word here is making dramatic changes. So if somebody's going through their, what we would call midlife crisis, all different kinds of things happen. And maybe they start to feel like they haven't met all their goals. And so they're trying to recapture their youth and recapture those goals, and the sense of urgency of, gosh, I haven't done this. I need to do this. And then entering middle adulthood. So that kind of goes over Levinson's theory, goes into a little bit more detail there. And then there's a video for you to watch there. And so we'll go back. And we'll talk about morality in midlife and late adulthood as well. So we will cover that there. So health screening, what health screenings are needed for those in early adulthood? So there is we talked about, this is one of your journal entries. We talked about this in that overview video, where there are adult preventive health guidelines, screenings that can be done, history and physical. There's also the lab section. Blood pressure screenings, depression screenings, hearing, lipids, all the labs that get drawn, mammograms, pelvic, breasts, ultrasounds. And then there are also checking for diabetes, doing a pap smear for the women, getting the prostate checked for men. And then testing, STD screenings, counseling, HIV prevention, colorectal cancer screening, getting your colonoscopy, bone mineral density. There's the prostate screening, lung cancer screening. So these are different, and there's your anticipatory guidance, things to talk about to your clients, that is there. So there's a whole list of those kind of things, and safety issues as well. Screening for alcohol misuse and abuse. So you have that available to you. Think of it as like the Bright Futures or the Ages and Stages questionnaire for the children. This would be for the adults. This would be the screening that they're doing to see where their health is. And then the recommendations, one of the CDC is a source, the World Health Organization is a source, but also what's called the United States Preventive Services Task Force, this is their website. I believe if I go back, yep. And it gives certain, it grades, if you will, to certain screening tests. And so if it's an A, it is that the U.S. Preventive Service Task Force recommends that the service, they recommend that the mammogram be done, or whatever testing it is be done. There's certainty that the benefit is substantial. And so providers should provide the service. Same thing with B, it recommends the service. There's a high certainty that the net benefit is moderate, not necessarily substantial, but moderate. The benefits outweigh the risks though. If the particular test, health and physical testing, is a grade C, this means that selective offering or providing the service to individual patients based on professional judgment. So it wouldn't be an automatic thing that the physician or healthcare provider would order, but based on individual situation of the client, they would order it. So there's moderate certainty that the benefit is that the net benefit is small. So it's not as a sure thing as A and B. So the provider might offer or provide the service for selected patients, depending on what's happening. And then the D would be discourage the use of the service. So there's the U.S. Preventive Services Task Force recommends against the service, or I, which is the current evidence is insufficient to assess the balance of benefits and risks for the particular service. So if when you go to the website, like we just did, you can look up different types of screening recommendations. You can do those that are published, have been published. You can do those, if you click in progress, it changes, and it means, for example, here we see the screening, the topic autism spectrum disorder in young children. We talked about that when we talked about when we were talking about the children, early childhood. And so pediatric is the age group, development and behavior. And so if we look at they're studying it to see what the recommendation might be. So let's click on it and see what they tell us. And so this was last updated in 2021. So that's a few years ago. The task force will ask for public comments. In this case, those are closed. And so it says they have final recommendations. That just talks about how they do all the process. So let's look at the final recommendation. And this is from 2016. So it looks like like it says here, it's being updated. So they had a recommendation and then they're updating it. And so there was an I, it was given an I, which is insufficient. So they had recommended children age 18 months to 30 months. We had talked about a year and a half or up to 3. So 36 months. So this is a little bit younger than that. The current evidence is insufficient to assess the balance of benefit and harm of screening for autism in young children, for whom no concerns of autism spectrum disorder have been raised. So if there's that you go for say the MCHAT, we talked about the MCHAT, and it doesn't show that there's a need for further screening, then the recommendation is not to do it. So there's no recommendation, but what they might be looking at, it's hard for me to tell, I'd have to sit and read through all this, is that, well, maybe they have it for older children, or maybe the recommendation is to have, excuse me, screening done for children who are at risk. And so that's kind of how you can read through the information here. You can also go by category. You can go by the grade if you want everything that's recommended, things that are not recommended or insufficient evidence. You can also go by age group, gender, pregnancy status, or the type of preventive service. So these are preventive services, things that are going to keep people hopefully from getting the disease or the problem that we're looking at. And so you have primary prevention, secondary prevention, tertiary prevention. So primary prevention would be, or actually secondary, let's do secondary prevention. Secondary prevention is actual screening, which is what this is. This is a system developed through the US task force for screenings. So this is secondary prevention. So we think the person may have it. We're not sure. We're going to screen, because if we screen and they do have it, then there are recommendations that we can make. Primary prevention is something whereby you are trying to keep the person healthy. And so you don't want them, you're teaching them something so that they don't get the disease. So maybe that's healthy eating, like the prenatal care plan that you all put together. We're teaching them about nutrition and exercise, and so that the mom doesn't have an illness or the baby doesn't have a problem. That would be primary prevention. And then tertiary or third level prevention would be preventing an illness, disease process from getting worse. So for example, if you have hypertension or maybe a stroke, you've gone into long-term care facility for rehab, and that would be considered tertiary prevention, because you're trying to get them back to as much of baseline prior to having the stroke that you can. And that would be first primary, secondary, and tertiary prevention. Levels of prevention, disease prevention. Okay, so that gives you the grades. That tells you what to look at. I mean, if you want to go look at the site, look up breast cancer screening or mammograms or prostate screening. You have the capability to do that, which is kind of cool, and see what the recommendations are. Let me drop down to communication for a minute. So this particular article hopefully opens up, talking about communication in marriage. So there should probably be a lot of therapeutic communication, hopefully, but it does give you some tips here, factors of active listening. Again, yes, that is part of therapeutic communication. silence, body language. And how do you talk to each other when you know there's something wrong to try and reset? How can we get back to what the communication that we had, assuming we had good communication earlier? And gives you some ideas of how to fix communication. So these are things that you could potentially talk to someone who comes to you because they may be coming in for a health problem, but you discover they tell you that they're having marital problems. So hopefully you could do some asking some questions and give them some suggestions. And then talking about adult learning theory. The articles are pretty similar, but let's look at andragogy. So you all have maybe heard of pedagogy, which is how children learn. Pediatric children, how children learn, which is which schools are trying to to change, to fix, I guess, if you will. But it used to be, here's the book, here's the facts, read it, learn it, memorize it, do it, and that's good. um, Children don't have necessarily the experience that adults have to relate certain things in life that have happened to them. So you can Knowles felt that adults tend to be more self-directed, internally motivated, ready to learn. So if you think of somebody, maybe some of you in this classroom, this virtual classroom, have come back to school because you want to be a nurse. And so you've been out of school for a while. Sorry, let's switch positions here. And so you have some motivation to do well because you're putting things aside. You're putting family or job or home, different things aside in order to reach your goal. And so you are hopefully ready to learn. You are self-directed because you have to be, and you're internally motivated because you want to accomplish this. You want to get through nursing school and be a nurse. I'm going to use that as the example. So if we as teachers, educators can play on those things, then hopefully we can help you meet those goals. So that's what Knowles basically did, is talk about the difference between teaching children and teaching adults. So 5 assumptions that we as a teachers and educators should make about you as an adult learner is that because you are an adult, that you have a more secure self-concept. Hopefully you've gone through adolescence and early adulthood, or at least adolescence. And so you have a sense of self and what you want to accomplish. And so you are able to take part in and direct your own learning. This is something that I see a lot that doesn't happen. And I'm not sure why, but I do see that a lot, that the expectation is that I, as the instructor, educator, am the one doing the teaching, which I am, but I can't do the learning for you. I can do the teaching for you, but I can't do the learning for you. Here you go. So that helps if you have a good self-concept there. All right, I am going to pause this for a moment. Okay, my apologies for that. We were talking about self-concept and that the early adult tends to have developed a self-concept. And based on that, that allows them to take part in and direct their own learning. Another piece to adult learners is the past learning experiences. So based on things that you have learned, things that you have experienced previously, that will, it gives you context. You can take what you learn and put it into context. Well, I learned this and this helped in this situation, but not in that situation. And you can draw conclusions, whereas children don't have that life experience. Readiness to learn. The value of education to most adult learners is they're ready and serious about it. So for example, for me, I did not get my master's degree until I had been a nurse for at least 20 years. So I was in my 40s when I went back to school to get my master's. So I was ready to learn and had a pretty good self-concept and could draw on my past experiences. And so you can be serious and focused on what you want to learn. practical reasons to learn, problem-centered approaches to learning. A lot of times adults will return to continuing education for specific reasons. For professionals like nurses, we have to continue, we have continuing education every 2 years that we have to complete, generally speaking, in our whatever our area of expertise is. But some adults will return to education. Maybe it's a career change, so that might be some person coming into the nursing profession from a different profession, and then excuse me, being driven by internal motivation. Children are driven more by not wanting to be punished or wanting to receive a reward, although I like to receive rewards all the time, but it's an internal motivation. So a student may say, I want to be a nurse, or I want to get my master's degree, or I want to go to school and to learn to be a nurse and then take my exam and then get my bachelor's and then my master's. But it's because they want to, there's something driving them from within that they want to do this. And so I think as in nursing school, what I see is because there is such a wide range of ages of students. We have students that, especially in our vocational nursing program, are just coming out of high school. We're having younger students in our associate degree program. And so some of those students are still in the adolescent developmental stage. And so trying to help them navigate the adult learning, we have to kind of help them navigate that. We can't have those expectations that they're going to be already set up as adult learners. And then if you think about the principles of andragogy, these are assumptions about adult learners. So educators should consider, I as an educator should consider when teaching you as an adult, there should be some sort of a say in the content and process of their learning. So I think that's kind of difficult in an online learning platform. I do try to give you some choices, or give you, for example, like the quizzes. You have a window in which to take the quizzes. And so to me, that's kind of your say of when you want to take the quiz. And because adults have so much experience, the focus should focus on adding to what you've already learned in the past. So that's why I like to do short answer questions, because then hopefully you can draw on something, or I'll ask you, have you experienced this? Do you have experience in this? Or what do you think of this? Content should focus on issues related to their work or personal life. So things tend to focus on work as a healthcare professional, because not everybody in the class wants to be a nurse. I've had students that want to be physical therapists, speech therapists, occupational therapists. Some students just take it because they would rather take 70 class than the Psych 25 class. This class is also specifically geared towards the healthcare professional. So if anybody's taken Psych 25 or knows people that take Psych 25, it's a little bit different in that it doesn't have specific assignments for the healthcare professional. And so in that way, the content is focusing on your work, and I try to draw out things from your personal life, and I share things from my personal life as well. And then learning should be centered on solving problems instead of memorizing content. So what I will do, for example, with the assignment on how does development affect an adolescent who is houseless. So I didn't ask you to memorize every single physical characteristic of moving from school age to adolescent, but what I asked you to do was to bring in what we've already learned about social determinants. You did your community windshield surveys, and now you've gotten the information about development. So now take that and let's figure out, is there, how did we get to this point, and what can we do to help solve it? And so that's why I like to do those types of activities and assignments instead of just having you list off the characteristics. So those are that gives you something to think about then when you're working through that assignment on adult learning theory. And I do believe that was what I wanted to talk to you about for early adulthood. So developmental tasks, we went over having her. So we did Erickson and Piaget. We'll come back around to Kohlberg in the next couple lessons. Health screening tests, we went to the United States Preventive Service Task Force. So the screening tests are there. And then physiological changes will be found in the PowerPoint. So let's take a look at that. Don't want to forget that. And my guess is it may take a while to load, so I'm just going to go ahead and download it. And let's open that up. Okay, young adulthood. Move that up and out of the way a little bit. And so, so thinking about matching the pictures to any of Havinghurst's tasks, I think was kind of something I had students doing. So intimate relationships, community peer groups, work, starting a family, having children, and then objectives. There we go. Young adulthood gives you the age range. We said 20s to 40s. Pretty stable period of growth. There's not the fast growth that we saw in the adolescent period. It's more stable period, and actually in terms of like physical growth, not as much. You've pretty much met you're the height or the weight that you're going to be, and so you're trying to be independent and have a family and have a job and those kind of things. Physical characteristics. So I think it's interesting that the studies show that the physical health, the peak performance is between the ages of 20 to 30. So by the time you get in your 30s, it's all downhill from there. Not for everybody, but I just think that's interesting. So the body's pretty much at its peak capacity, and the brain has finally matured. We talked about that in adolescence. We had that picture of the brain that showed you that. These are just specific physiological changes, and looking at blocked arteries and health, and treating your body well in the early stages of life will help you to be healthier in later stages. So again, I don't expect you to memorize or know these specific physiological changes, but that things are at their peak performance and will sort of start to decline from this period. And so women's health is a specific field of study. And so especially with pregnancy, childbirth. And so that's important. It says education and access to care have increased. I'm not sure access to care has increased. I think it kind of cycles. So sometimes we have more access and sometimes we have less access, but it is important. Hopefully as healthcare professionals, we can know what local resources that are available so that we can send people to those resources. In terms of reproduction, the functioning is at its peak. There are cases where there is infertility. So there's counseling and specific physicians that deal with that. But I think now, especially stress, like expenses, things are so rough for young adults these days. And we talked about some of these in the pregnancy unit in week 5, sexually transmitted diseases, screenings, breast exams, doing self-breast exams are important monthly. Men's health, based on just their activities, may be higher risk for injury. Testicular self-exams, prostate exams are very important. Nutrition, be careful about supplements, steroid use, things like that. Enhancers, physical enhancers can be really, really dangerous. So some health concerns for the young adult. So if you're looking at a health promotion campaign for the young adult, these could be potential areas for you: obesity, sensory impairments, exposure to carcinogens. So teratogen is something that's harmful to the fetus, whereas carcinogen is something that potentially causes cancer. And so there's a lot of different potential exposures for young adults. Sexuality, we talked a bit about this in adolescence as well, but looking at gender roles, relationships, attitudes about sex, a lot of it depends on how you were raised, your culture, developmental level. Um, and then depending on what kind of relationship you had or you witnessed your role models when you were young, that can affect your intimate relationships in early adulthood as well. One of the major tasks, intimacy versus isolation, intimacy, and to be able to have a develop a warm, trusting, honest relationship with another person. If one of the people does not have a clear sense of identity, then that could be isolating for one or both of those people. And intimacy, those kind of relationships, it takes practice and takes commitment. It doesn't mean you have to stay in that relationship forever, necessarily, but it takes a lot of work. So marriage, a lot of people are opting not to get married these days as well. But if you are, pursuing education, then maybe you postpone marriage. You often will select somebody that's very similar. Sometimes you'll choose someone that is very similar to one of your parents. And there's many things that go into choosing a partner. And so stress and coping, so many things, right? Work, marriage, money, school, everything. That's a lot of stress. And so depression, anxiety are huge things in early adulthood, can be. And then also intimate partner violence or abuse. We talk about violent behavior against women, but there is violence against men as well. So this is an older statistic. I don't unfortunately know the current statistic, but 1 in 3 women and 1 in 4 men have been impacted by domestic violence or intimate partner violence. Parenting, so we're doing childbearing, child rearing. Not everybody wants to get married and have a family, and that's okay. But you see a big jump in learning and reading books and asking family members, once you find out that you're pregnant, to be the best parent that you can be, hopefully. And then being able to learn those healthy parenting styles that we talked about in earlier weeks. So we have, I think we've pretty much talked about the Erickson stages of intimacy versus isolation. This gives you some more information. And then being able to establish a home and family, groups and having nights out or meeting with friends and doing activities, expanding your social circles, and then being mature in terms of being able to have your own belief systems, your own beliefs and values, and taking responsibility for your life and being mature and running a household and having a relationship and caring for a partner and children. Cognitive development, we talked about formal operations, college, going on to other schools, vocational schools, how that adult learners learn a little bit differently. And then moral development would be the post-conventional stage. The person is capable of choosing their own moral principles, the ones that they think are in context, is something right. Oops, don't know what that is. Sorry. Of right or wrong, and respecting the rights of others. There might be a greater appreciation or deeper understanding of religion or faith. Learning from other people and the social circles that you have, learning from other people and caring for other people, getting in that intimate relationship, which I think is it is true that you have to have your own self-concept and know about yourself before you can share yourself with other people. And so moving on to nutrition. So now, since things are starting to downslide after 30. We're going to start worrying about hypertension, heart disease, strokes, osteoporosis, things like that. And so there's screenings for that, which is that secondary prevention. Your health promotion campaign that you're doing is more of a primary prevention strategy, because you're trying to provide information prior to the person having hypertension or heart disease. Smoking is a big problem, leading cause of all these things. Sleep and rest. We still need sleep as adults. I love to power nap. I think we need more sleep as we get older too. And all this worry and anxiety and stress can lead to insomnia. My kids tell me that they have issues with insomnia because of the stress that they have. And it's very difficult for them sometimes. So exercise and leisure, still looking, my goodness, still looking at this one says 2.5 hours of moderately intense aerobic exercise every week. I think we were at 60 minutes. So a little bit more than, I think that's 3 times a day. This is twice a week. So looking at different types of arthritis there, you have how the joints can be affected, weight gain. We don't, we hold on to weight, I think, a little bit more, at least I do. And so you can end up with all kinds of joint pain, back pain. As a nurse, especially, proper body mechanics are really important, so that you don't end up with back pain or knee pain and have osteoporosis and osteoarthritis. So safety, what are some safety things to consider for early adults? So now that you are in a relationship, that you have a household you're responsible for, you have children, so safety doesn't just center on the individual necessarily anymore. It also centers on the family. So concerns in terms of motor vehicles, drunk driving, firearms, are the guns stowed separately from the ammunition, those types of things. Home safety, accident prevention. Do you have a fire plan? This is a fire escape plan. Do you have that figured out? If there's an intruder, drinking, so many kinds of things, more on a global outlook than just individual. And then the teaching techniques, looking for ways to help adult learners learn more successfully. And so relating information to developmental tasks, and hopefully interactive and problem oriented and not so much memorization. All right, so I'm going to stop sharing my screen, and then just sitting kind of in the corner here. Yes, I know. And that will do it for early adulthood. So if you have questions, you know how to get a hold of me. And the next video will be on middle adulthood. So we will see you in the next video.